Jessica Parlor. I'm a licensed clinical psychologist in New York and Colorado. Great. I love working with anxiety patients, particularly those experiencing severe symptoms of OCD. I have a lot of respect and admiration for anyone managing very, very difficult and intrusive thoughts and disruptions in their lives. And I really want to be a true support and guide, right? As you find recovery and reclaim everything that you feel like OCD is taking away. Initially, as we go through the assessments that are going to ask you about the intensity, right, and the severity of your symptoms in OCD, specifically when you think of driving down the road and hitting someone, how intensely does that impact you? And then, truly, how distracting is it? How does it overwhelm and overtake your ability to function and think about other things? We're going to measure that very, very specifically in all of your obsessions and the compulsions. Largely, most patients will be able to demonstrate and clearly tell me this has caused a problem for X amount of time. And then there'll be some things that I will point out just in my clinical experience that most patients are unaware of that are equally affecting their experience with anxiety. Sometimes that has to do with the environment, right? Sometimes it has to do with our acceptance and commitment of the struggles that are present, and also some of the ways that we have been harmed or may have harmed others because OCD has been so prevalent in our lives. So we're going to be very clear and ground ourselves in the facts of what's going on so that when we're moving forward with treatment, it makes good sense and it has ability to have good progress. The other part, immediately, we have to start working on not letting the OCD continue to be the big monster in the room. We're going to turn around. If it's behind us, we're going to turn around and look it in the eyes and let it know this is OCD monster. Sometimes it helps to really create an OCD monster and name it. But we want to separate a little bit. You are not OCD, right? You are not your OCD. And that sometimes helps patients get on board with the treatment a bit. We're not attacking you. OCD has attacked you and a lot of the things you enjoy. That can be heavy as we start to talk about the sort of exposures that are necessary to address your OCD, the compulsions that have started to take up a lot of time, and those obsessions that are intrude into your thoughts frequently. I'm a very accelerated, concentrated version of a clinician, of a psychologist. I absolutely appreciate all kinds of presentations in humanity, including the more severe, loud, reactive. I just think those people are bold sometimes, right? And letting us know what they need and want and what's not okay, right? And so I really can hold a lot of space for that without myself becoming reactive or overly concerned. I can assess whether there's threat here to be concerned about, or if this is somebody that's honestly expressing themselves in a way that maybe many don't for some time. I will stay in it. I will stay physically close, and I will stay involved and invested. I'm not going to withhold. I'm not going to withdraw. And you will absolutely, I hope, feel my presence as warm and comforting. And that this is somebody who is, when they're invested, they're going to be engaged in how to make things better. Okay. And also take that, I call it a clinical responsibility and accountability, right? I don't shy away from that because people, that's what they're asking. If they're struggling, they want somebody who is an expert or is going to hold the space of an expert clinician in that. And I honorably and you feel like take that task on.
Is there